Welcome to the Health Made Easy podcast. Health advice so easy, you'll feel more confident about your body, health, and life. And now, your host, Dr. Connie Jean.
Hi, this is Dr. Connie. So with over 23.5 million individuals suffering from autoimmune diseases, this epidemic deserves a second look at the root cause and the reason for the rising symptoms and incidents all over the world. It's important to note that most autoimmune conditions tend to overlap one another. According to the National Institute of Health, 25% of autoimmune patients tended to have a tendency to develop multiple autoimmune conditions. Lupus in particular is a challenge to diagnose as it mimics multiple diseases. This is because the disease can affect all systems in the body. And as a lupus patient, I have mixed soup of antibodies as described by my rheumatologist. And I have biomarkers for potential multiple connective tissue disorder and Sjogren's disease. But since I have no clinical signs, we just simply watch my biomarkers. If you've been following my social media feeds and my blog, I wrote about the root cause of lupus or any autoimmune disease as the mitochondrial dysfunction. This makes more sense to me because the pathology lies in the molecular dysfunction as opposed to being overzealous at looking at the pathophysiology after the fact. And after 19 years, it makes more sense to me to focus on the root cause than on the pathology. And focusing on the pathology of lupus or autoimmune or cancer or whatever fails to address the body as a whole system, and we fall prey to mitigating the symptoms by adding toxic medications that potentially sets off other unintended consequences, which are sometimes very devastating. This is because we know and understand that our body struggles when homeostasis, which is a balance in the body, is disturbed by its innate compensatory mechanism to keep our body from harm. Once taxed and burdened to its threshold is when we end up with a host of symptoms. So symptoms are a way of our body letting us know it needs help, that it's burdened. They're not asking for a medication to calm just one small aspect of the whole system. Rather, they're asking for help in recalibrating the body to achieve homeostasis again. I believe that any disease is due to mitochondrial dysfunction. That's where it starts. So on with the autoimmune triad. Thanks to the work of Dr. Alessio Fasano, a physician and researcher at the University of Maryland, he and his team have discovered interesting findings on celiac disease, which is an autoimmune disease, which is relevant to all autoimmune conditions. This is exciting because of the possibility that treatment approaches to celiac disease may benefit other autoimmune conditions as well. Dr. Fasano found that for patients with celiac disease, which is an autoimmune condition as mentioned, 3 factors must be present for the disease to manifest. One is a trigger, a genetic susceptibility, and a permeable gut, also known as leaky gut. This validates my personal hypothesis for over 19 years. Number 1, trigger can be an event, much like the straw that broke the camel's back. It can be a cold, a flu, trauma, or an emotional turmoil that does you in. For me, it was the snowboarding after weeks of intense studying, the stress for an entire semester. As a first-time snowboarder, I fell hard multiple times throughout the whole day. And the sun exposure didn't help. I noticed the extreme fatigue that set in, coupled with a rash on my face. This was the start of it all. I just couldn't get over this hump. When you think of a trigger though, I think it's important to understand that it's never one episodic moment or an event. There usually exists a cumulative burden in the way of emotional stress, physical stress, or psychological stress. And as a graduate student at the time, I wasn't eating the best of foods, had terrible sleeping habits, and was constantly stressed from my course load. Number 2 of the 3 factors is genetic disposition. You are dealt a deck of cards in a way of your genes. It's how you play your hand in life that will determine your gene expression. I've always had migraines from a young age and had underlying digestive issues prior to the diagnoses. I was fatigued easily and got sick often. I've ignored those symptoms for many years, dismissing them as something that everyone goes through. And I have a twin sister, and my mom and I were comparing our notes about the past, about how my twin sister was always so much healthier than me, had higher tolerance for stress, and never got sick. The third factor is gut permeability, also known as leaky gut. Lupus patients and all autoimmune patients have leaky gut. As a result, we have mitochondrial dysfunction, which leads to a host of systemic inflammation and immune imbalances. The good news is that since we know the root cause of our issues, we can then work on fixing our issues once and for all. So gut permeability, leaky gut, exists due to any type of stress, antibiotic use, and toxic load. Most people have gut permeability issues to some extent. And according to the NIH, 60 to 70 million Americans have digestive issues, which is responsible for 36.6 million doctor visits and 7.9 million emergency department visits and 141.8 billion in healthcare costs alone. Yet, the medical system fails to acknowledge the role of diet and nutrition in the health of individuals. An average physician spends approximately 23.9 hours in medical school in nutrition. Most of their time is spent on studying the pathology of disease. What good is that after the fact, after the disease process have taken over? It should be more about prevention. It's clear to me that autoimmune conditions can be prevented and reversed. However, the medications to manage such conditions are seen as the gold standard, and often patients are at the mercy of such indoctrination of necessary medications from their doctors. How do I know? As a functional medicine practitioner, a physical therapist, and a registered dietitian for over 19 years, I've had a fair share of patients wanting alternative methods to address their diseases, from diabetes to cholesterol management, cancer, and various autoimmune conditions. And the physicians often threatened or scared those patients into thinking that without the pill, our conditions will worsen to a point of no return. And as a lupus patient, I have challenged the medical regimen that treats lupus with toxic medications, such as chemo agents, corticosteroids, and pain meds. Rather, I fought very hard to decrease the meds and have been very successful. Key is in understanding that there is a better way, and making informed choices about your treatments is key. Question your doctors about why they prescribe specific meds for you. Understand the risks, and then decide as a team with your physician what may be best for you. I know that our autoimmune disease, or any disease, can be reversed by lifestyle changes regarding the foods we consume, thoughts that we think, stress levels, and exercise. There are 5 stages of any disease, particularly in autoimmune diseases. Number 1 is stage of susceptibility, less than optimal health state due to physical or emotional stress, right? And then stage 2 is the stage of subclinical disease. Pathological changes start to take place in your body without the symptoms manifesting. You start to feel a little funky. Number 3 is the stage of clinical disease. This is when you get the stamp on your medical file to say you have a certain disease. Number 4 is stage of management, flares, and remissions. This is where you dance with your disease, right? From medications to sometimes feeling better than others and sometimes feeling better. Number 5 is stage of recovery and healing. I believe that at every stage, we can work to reverse our disease by taking ownership of our body and health. Healing is an inside job. So want to get started? Well, learn how to reset your body with our autoimmune healing protocol, find out how toxic you are, and read about our detox programs, and exercise with me on my YouTube channel. For those of you who are listening in on my podcast, you can find the show notes and the links to these resources on my podcast, conniegion.com/podcast/. And for those of you who are watching this on YouTube, you can find the links to my blog in the comments below. Thanks for joining me. Please subscribe to our podcast, leave a review, it really helps. And YouTube, and follow us also on Facebook. I'll see you next time.
Thanks for listening to the Health Made Easy podcast. www.drconniejean.com